Hello and welcome to Therapy Chat. My name is Dr. Dawn Parks and I'm here with Phoenix Behavioral Health, and our guest today is Christine DesLauriers, licensed social worker and addiction specialist. And today, just to do something a little bit differently, we're going to look through some of the more common questions that we've received since we've been on the air, which is about 6 weeks now. So we have had quite a few questions via email and some phone calls, and we're going to start looking at number one, which is, what is the best way to improve my overall well-being? I have a lot of clients who ask that. We've had a lot of questions about that from viewers. So perhaps today we could talk about that, start talking about that, and we could both perhaps discuss some ideas.
I would start out by saying probably the best thing that people can do is move. M-O-V-E, move. I think I say this often to clients that are struggling with depression, because the bed is not your friend. Right. And I know it's tempting, especially in the cold weather and the dark days, to kind of crawl into bed and not come out. But the best thing you can do to counteract any kind of anxiety, any kind of depression, just generalized health, especially in the COVID era where people want to eat healthier and be healthier and have stronger immune systems, is to just get out and move. You don't have to do anything super. If you want to join a gym, or if you want to do get into a personal trainer situation, that's terrific too. Yeah. But I think just walking every day, 15, 20 minutes every day, getting the fresh air, getting the blood flowing, exercising, that's the best thing you can do for yourself. And it does impact your mood.
It does, yeah. And I think probably one of the big problems with that is people wait until they have decided upon the perfect exercise or contacted the right gym, and then that delays the whole issue. So what, like you said, moving, it could be anything at all. It could be just putting on some music and dancing a little bit. Could be stretching, could be, nowadays you can find anything on YouTube, on the internet. Any kind of movement is good and better than just sitting or staying in bed.
I tell people to just get out of bed, put the alarm not next to your bed. Put the alarm across the room so that you have to get up to turn it off. Get out of bed, get in the shower, go downstairs. Even if you don't do anything beyond that, that's better than staying in bed.
Yeah. Another thing, sleep is really important. When someone's stressed or depressed, anxious, all of this can impact sleep. But on the other hand, poor sleep can exacerbate stress, anxiety, depression, mood. So really trying to look into what constitutes sleep hygiene, such as trying to turn the lights down about an hour before sleeping, cutting down the caffeinated drinks, trying to do something a little bit more relaxing, calm, trying to keep a schedule, trying to go to bed at the same time at night, getting up at the same time in the morning, making sure your bedroom is at a comfortable temperature.
Turn off the electronics.
Yes.
At least half an hour before you go to bed. And sometimes too, watching what you eat before you go to bed. A lot of people will snack, which has high sugar content, and that will interfere with your sleep.
Which brings us to diet. Really, really important, because diet has such an impact on overall well-being, on physical energy levels, on stress, on the immune system. So it doesn't have to be this perfect diet, but if you keep in mind, every day we need a good balance of proteins, of complex carbs, fats. We want to get our fresh fruit, vegetables, lots of vitamins, lots of hydration, lots of water, trying to cut down on the caffeine, cut down on the alcohol, cut down on simple carbs like cakes, pies, pastries. I think carbs get a really bad reputation, and so defining that importance between complex carbs and refined carbs. Complex carbs are really, really important for maintaining a good energy level throughout the day. Complex carbs are things like unrefined foods, oatmeal, sweet potatoes, general lots of fruits and vegetables, and then cutting down the candy and the chocolate and the soda, which are more the refined carbs. What else? And also important, fresh air. Not just because it's fresh air and we're oxygenating our system, but also because there's so much stimulation from being outside. You know, when we're looking at different colors, we're hearing sounds, we're stimulating the senses in general, so it's kind of like a wake up kind of feeling for the senses. Yeah. Anything else on that?
I would just echo what you said about getting outside. I think in this era of sort of isolation that we've all been in, it's really important to leave the apartment or leave the house. Even if you're just walking down the street and you're waving to your neighbor who's 50 feet away, that's okay. I mean, just get out, see somebody, get the fresh air, get, as you said, get the stimulation. Don't stay locked in the house. It's not healthy.
Yeah. And the key is do something. And even if it's one small thing, even if it's for 5 minutes, that's the beginning. And sometimes the beginning is often the hardest part, just taking that first step. Another question: how do I know if I'm too stressed, if I'm getting overstressed? Because remember, we talked just the other week about a certain amount of stress being good and healthy and a positive thing. But how does someone know if they're passing that point and they're getting to a more critical or difficult, uncomfortable point on that continuum?
I think people have to pay attention to what's going on in their bodies. That's the first thing, is to start to be aware of changes. I think oftentimes when people get stressed, they will find themselves maybe overeating, or maybe skipping meals and not eating because they're overworking and they're sort of neglecting themselves. Substance abuse plays a role. Oftentimes people come home and they're absolutely exhausted, or they can't wind down, and then they start drinking or using substances to try to counteract that, and then that might work the first time or two, but then it becomes almost a habit, and a dependency can potentially develop. And pay attention to how you're sleeping. People have, racing thoughts. They can't get to sleep at night, or they wake up in the middle of the night very stressed, again, with racing thoughts. I mean, all of those things that you hadn't been happening to you, or hadn't happened to that degree, would be little red flags that you need to pay attention to, that maybe you need to stop and take account of what's going on in your life.
Yeah, I think sometimes I see that you can become, you can get to a point where you feel exhausted and overwhelmed, but you're not perhaps being aware that you're leading up to that point. Just one day you wake up and you say, well, I can't do this anymore. But being able to connect to that earlier on, when it's starting to begin, is so important. And like you said, with the body, it might be feeling tension in the body. It might just be feeling kind of more aches and pains, and realizing that's from kind of holding the body in a very tense position throughout the day. Headaches, stomach aches. diarrhea, constipation, and changes in appetite, like you said. And looking at changes in action, it might be that, you know, I used to like a drink occasionally. Now I'm drinking twice as much. Or now I've stopped engaging in my exercise or the hobbies that I used to enjoy. I'm not doing that anymore. Or I'm getting irritable and impatient with people who I usually get on with. It may be I'm just feeling overwhelmed when normally this is doable. Now it feels like I'm stuck and I don't know where to begin. And what's my thinking looking like? Am I tending to be overthinking, like you said, racing thoughts, or am I kind of thinking everything in a very negative way, you know, or very anxious type of approach? So if we're noticing that in advance, we can start to address it while it's still manageable. I often hear about cognitive behavioral therapy. Can you explain what that is? And you know, earlier on, I was saying to you that you know, sometimes I'll have a potential client calling me and saying, you know, I'd like to engage in services and with CBT, but they're not sure what it is. But you hear a lot about it, so perhaps we could talk a little bit about that.
Okay. Well, cognitive behavioral therapy is very well respected. It's very widely used, very common, and it's very effective. It basically is a way to change your thought process. And it is looking at other possibilities. An example of that would be, a lot of times people do what we call awfulizing, which is they come in with the worst case scenario and they envision it for whatever the situation is, and as a result they're having terrible panic attacks, or they're terribly depressed, or they're feeling extremely discouraged, and they're very stuck. And what cognitive behavioral therapy does is help them to look at other possibilities. That is, that extreme thought process likely to happen? Chances are no. I mean, is it possible? Of course it's possible, but the reality is there's probably a lot of other factors that are going to intervene, and there are things that you can do yourself if you talk your way through it. Some potential coping skills, some potential strategies that you could even implement to control the situation a little bit and change the direction of it, so that it doesn't have to be the worst case scenario. And once you sort of start to learn how to do that in therapy, you can start implementing that yourself at home as part of your homework, and you can start pulling yourself back from sort of going down the train track to the worst possible scenario.
So it's kind of the ability to challenge our thoughts, and sometimes when I'm working with clients with this approach, a person may not even realize, oh, I can challenge that thought. It's not necessarily true. You know, when I went up and gave that speech, I didn't look like the worst person in the world, even though I might have felt like it. So what's a more reasonable statement? I can challenge that statement, and I can say, it might not have been the best speech, but I don't think it was the worst ever either. Perhaps somewhere in the middle. And what can I do about that? Well, if I have to give another speech, I can perhaps practice it a little bit, read up on it a little bit. So yeah, and it's very empowering too, because now I'm not stuck in this bubble where thought comes up and I respond as if it's true. I can actually break out of that bubble, and I can challenge it, and I can modify the thought. So it's very realistic too. We're not, sometimes I see this, it's a misunderstanding that, okay, if I think a negative thought, I just say the opposite. It's not that, because it's a very realistic and practical approach. right? It's just modifying that thought a little bit.
Oh, the other thing people do besides the awfulizing is they do a lot of mind reading. And so, especially in personal dynamics and family situations, they'll assume that someone doesn't like them or someone feels this or that way about them, and they have that negative thought in their mind before they even have the encounter. And so, or maybe they've had an encounter and they misinterpret something that someone says or does, and they come away from it feeling very much like that person's out to get them, or that person did this deliberately to them. You know, chances are there's some misreading in the situation, and it probably isn't as simple as that. It's probably more complex. You know, if someone doesn't, for example, call you back that you've reached out to, you know, the first thought is, oh, they don't like me. You know, and then you become angry, and then you become upset. But the reality might be that that person is just very busy, and they haven't had a chance to call anybody. Maybe they've had a crisis, and they haven't been able to answer the phone, or to attend to anything. Maybe they're sick. I mean, there's a lot of possibilities that before you go to that extreme one, that gee, they don't like me and they're rejecting me, it might have absolutely nothing to do with that. So that's another thing that happens a lot in these situations.
So if we think of, you know, there's a trigger, person says something, or there's an event, situation, we have a thought, right? And the thought, depending on the thought content, is going to modify the feeling we have about it. So if we think a negative thought, going back to that speech, you got 5 minutes to do the speech, right? The thought is, I will forget everything I wanted to say, right? Then the feeling is perhaps anxiety, and the action is, I never go back there. Or we could challenge that thought and say, I only have 5 minutes notice, I'll go and do my best. I might be able to come up with something that's useful, helpful. So that modifies the feeling. Oh, I'll give it a go. I'm a little bit anxious, but that's okay. And so then the outcome is I actually go and give the presentation. And I'm a lot less anxious than I would have been. But I think it's important to say too that although CBT is a really strong evidence-based practice, really good applications, it's not good for every situation. And so, for example, if we're working with perhaps trauma, we need to be doing a lot of work on an emotional level. So we might have different approaches, but CBT is a really, really good therapeutic tool to have. Okay, here's a question. How do I know? This is kind of in two parts. How do I know if I have a substance abuse problem? And the second part to that was, if I had a substance abuse problem and then I've been sober for a few years, can I go back, let's say it was drinking, can I go back to drinking socially, like most people I know? So it's a kind of it would probably take a lot of time to answer that in depth, but in the time we have here, we can perhaps just, you know, give a little bit of information on that.
Well, in terms of answering the question of whether I have a substance abuse problem or not, I would say anything that you have to control is already out of control.
Yeah.
So if you're finding that you have to try to rein in your drinking, for example, or your pot use, or whatever the substance might be, then that's a red flag. Truly social drinkers do not need to put any constraints on their behavior. It's not how much or how often you drink, it's what happens to you that's the key. So, you know, you could drink every day and not have any problems. There are some cultures that have a glass of wine with dinner, and it's literally one glass of wine, and there's zero negative consequences, and they're fine. And there are other people who maybe drink once a year, but when they drink, they're out of control.
Yeah.
They're getting into fights. They're blacking out. They're getting DWIs. Those are that's not social drinking. So if you're finding that you're having problems, whether DUIs, people maybe making comments about your drinking, family members being concerned, or you yourself are trying to control it, then that's a red flag that things are out of control. In terms of the second part of the question, this happens quite frequently. I think people, it's very, very difficult to come to terms with the fact that you have a drinking or drug problem, and to make changes like that, because they're monumental changes. You have to change a lot in your life, and it's scary. And quite often the substance has given you a lot of comfort, even though it's also done a lot of damage, and you don't really want to give it up.
Right.
So when you do, there's a lot of romanticizing sometimes that happens down the road when you've had a period of sobriety, where you start to just remember all the good things about using and not the bad things that happened.
Yeah.
And you start telling yourself, I've been good for a year or so, or several months, and I'm sure I can drink again okay. Right. And you do. And, probably in the beginning, the first few times you pick up the drink, you probably can control it, and you probably can manage to keep it okay. But it won't stay that way.
Right.
The reality is, if you've had a problem with something, it's going to come back. It's there. You can't be something you're not. If you're not a social drinker, or you weren't a social drinker, you can't become one. And within a period of time, you will pick up not only where you left off, but where you would have been had you continued to drink. So actually it gets worse.
Right.
And that will happen, and everyone's a little different. For some people that might happen within a few, within a month of picking up again, and for other people it might take several months or even a year, but it will happen.
Yeah, and just to pick up on that too, again, underlining the importance of therapy that's going to address not just the drinking. That you can say that the drinking or the drug use is like the tip of the iceberg, and oftentimes that visible part of the behavior is addressed. Okay, I'm not drinking anymore, and then all of this stuff remains unseen. And so it's always there, and it's always very easily going to become visible again. So in treatment, this is why early recovery is considered such a long time. I mean, at least a year, could be a little more. But we have to address all those driving issues beneath it. So changing, and this I think is really important, changing the relationship we have with the drug or the drink, the way we look at it. Because if we look at it, as you said a few minutes before, as something that we're missing, it's not fair. I can't go to those parties anymore. It's not fair. How come everyone else can do it and I can't? And you get angry, and you get just upset, and it's hard to move forward in that, with that kind of an outlook. So changing the relationship, changing the way I look at that. What does that mean? And really being realistic about that. What does that drink mean? And being able to come up with, losing my job, losing my driver's license, losing my friends, possibly losing my family, and now the relationship starts to change a little bit. It's not as it's not something that I really miss, actually. And you see when someone's at that point, because this is the person who can probably go to a party and everyone's drinking, and it's okay. I just don't want to drink. You know, it's not something that I feel is a loss. It's actually a gain that I don't want to drink, you know.
Yeah, I think what you're talking about are the isms.
Yeah.
And there's, you know, you can stop drinking, but there are all these isms that were part of the reason that you did drink.
Exactly.
And those have to be addressed.
Absolutely. And last question. It's actually not the last question. There's about 10 more, but the last question for today. What should I expect if I think about going to therapy? I've never been before. What's it like?
Well, it's a little bit scary, I think, the first time you walk in, because you really aren't sure what to expect. Yeah. But basically what a therapist will routinely do is sit down and have a conversation with you. And the first visit generally focuses on kind of an overview of what's been going on, what brings you here, what the concerning problem is, kind of some goals that you might want to work on, and a little bit of background information they'll ask, just so that they have kind of an idea of, you know, who you are, where you've come from, kind of what's been going on in your life. And then once they gather sort of that initial intake information, then you're set up with weekly appointments. And as time goes on, they may stay weekly, or you may agree to do them less frequently if things are going well in your life. And it's just about helping you develop coping skills, helping you to maybe, if you're suffering from trauma, we can talk about that. If you're struggling with substance abuse, we can talk about how to work on that. And you know, you set the goals that you want to work on, and we help you achieve those goals.
Yeah, I think it's important to state that your therapist is not there to tell you what to do. We're here to work together. So we are here to give you honest feedback and to be a good, strong support system. But the idea is that you will become more empowered, right? In the choices you're making, in the way you're responding, in how you're looking, your general outlook on life. So it is a joint effort, and we're not here to be judgmental. We're here to work with you. I think that's all we have time for today.
Great, thank you.
And thank you for joining us today for Therapy Chat. As usual, please call 508-623-3931, or you can send any comments or suggestions, anything that you'd like us to talk about, explain. You can contact us at phoenixinfo.online. That's drparks@phoenixinfo.online. And over the next few weeks, we'll be focusing a lot on stresses related to holiday. Whether it's family stresses, just everything being so busy and rushed around this time of year. How do I still make time to take care of myself and take care of my stress levels as well? So thank you for joining us, and we'll see you next week.